Okay, so in this tutorial, we'll be talking about the different types of notes. Specifically, this tutorial will focus on the evaluation note. In subsequent videos, we'll talk about dailies, progress, and additional workflows within the Epic hyperspace. So when you double click on a patient in the schedule, it's going to open you up to this screen. If they haven't arrived, typically we do some pre-charting. Then you'll get this tab, pre-charting. I almost always start the visit immediately, and with a initial workflow for the evaluation, we're going to need to do a couple things. We're going to need to create an episode. It's going to be PT, whatever the body region is, and then the year 2025. So that would be, this is the uh, kind of template. But if they were coming in for lumbar spine instead of body region, right, you would put like lumbar or right knee. You could put in comments if you want to specify if there's like a uh, disc herniation. That's not necessary, but this needs to be established. The other thing that you're going to want to do is you're going to create a add to a problems list. Historically, with student uh, yeah, with students' accounts, sometimes they don't have the ability to add to the problem list, and the CI will need to come in and add that in over that. But presumably, you can hit like uh, usually chronic low back pain, for instance. If it's already part of their problems list, then you can see the different qualifiers, whether they have bilateral sciatica, left sided, without sciatica, so on and so forth. For the time being, we're going to click on that just uh, as a basic chronic low back pain, no sciatica. In this case, we're going to hit accept. It will ask for additional qualifiers. We'll call it midline, without sciatica, and accept. You'll see here that it becomes pinned. We could, if it's already listed within their problem list, you could hit pin and then hit this, which links this diagnosis to this visit. The pinning pins it to the top so that it's easy to find. There's not too many problems listed for this patient particularly, but in some instances, this is an extensive list. If it's not already listed and you want to add it, as I mentioned, it is limited sometimes, depending on the amount of free range that you have within your Epic sign-on. You may or may not be able to add it here. I'm pretty certain that you can do is you can add it down here, which adds it only to this visit rather than to their medical record. So this would be another one where you would go through the same thing. It's midline, without sciatica, and accept. And if you wanted to add an additional one, maybe it's like sciatic pain, or maybe they also come in with hip pain, you can certainly add additional problem lists to give a more candid picture as to what they're coming in for. You'll notice that in this visit diagnosis that there's this diamond that's not existent in the problem list above. This is their primary diagnosis. That is the one that you're predominantly billing for. And if you had 3 diagnoses, for instance, it was like left hip pain, okay, now there's 2 of them. Again, you can pin this, and then you're like, well, their primary complaint or the primary thing that we focus on was left hip pain, so that's going to be my primary. I'm going to come in and then add diagnosis to problem list, and it can be added above, and you'll see that it has been. So that's going to be what's going to happen on the episode tab, and that's usually the first place you go. The other thing that you can do, sometimes it's not clear as to why the patient has been scheduled. Typically, in the regulatory snapshot, there would be a link diagnosis. You usually see it over here in your sidebar here. You can see that this section is redundant with the reports tab over here. So usually this is collapsed. It looks something like this. And when they have a referral, it would be listed here. And you can click, it's a hyperlink, you can click on it. It will also give the date of the referral, and that would show the additional specifications. I guess I also should have just oriented you to the tabs at the top. So the chart review is what you may think. It's all their medical appointments that have been past, current, and future. And then you can see within their medical chart the additional tabs within that. So it's a tab within a tab. So for instance, another way that you can navigate to the referrals is that you would come in here and you would see, like, again, there's no physical therapy referrals that I can foresee, but consult and treat, for instance, hepatology. Perhaps it says physical therapy, for instance. You would scroll down, you could see what the diagnosis is, the referred by, the referred to, so on and so forth, any additional notes. And then based off the date that referral was placed, you could come back to their encounters, say, oh, okay, there's the date that the referral was placed, and there's the referring physician. Click on that note, and that would be a seamless way of which you could identify what occurred within the encounter when the referral was placed to get a better idea as to why they're coming in. Additional relevant tabs that you see across the top is if they were post-surgical. The operative note won't show in their encounters, but it would show in their notes list, where you would come in and it would clearly say operative note, and you could click on that, and that would show you the further detail as to the operative note. Additional relevant tabs is going to be RAID, or as in radiology, and this is going to be where you could come in and you would see the radiology reports. So you can, in this case, there's no reports listed. It's really just the overall chest view and the referral that has been placed because the person hasn't actually gone under. You can see these have been ordered, pending future, but it would have said completed if that had been done, that scan. But those are the predominant tabs: encounters, notes, radiology, and referrals are the ones that you would particularly focus on. You may find procedures if they had other procedures that you wanted to look at, but usually I find that under the notes tab. And that's within the chart review. The episode tab is what we had gone through initially, and the purpose in navigating back to the chart review would be to identify why they're coming in. Essentially, what the referral, what was the ICD-10 code for the referral. Okay. Hopefully we will set up your Epic workspace such that it is in a strategic and kind of logical workflow, so that you go, I'm going to review my chart, I'm going to create my episode, and then I'm going to go to my notes. This is where you set up your initial eval. So for all eval notes, you're going to come to create note writer. You're going to type in eval or rehab evaluation. You'll click on that and hit accept. Okay. Let's clarify that on the left-hand pane, so that's from here to here, is where you're going to do the predominance of your documentation. And then in the right-hand tab, this is what these two are linked. So you can see this is actually what populates within the note. For instance, if I hit like safety features, so you can see that it populates over here. So one of the things that we utilize, and I have another video that will describe these, is something called macros. Macros are, think of them as templates, and there's macros that are designated for each one of these different tabs. So we, as a team, we've established, in a department, we've established that we're going to write, instead of SOAP notes, we're going to write APSO notes. It's the same mnemonic, with the exception that we're just going to reverse the order of them. So we're going to go assessment, plan, subjective and objective. And we do that because the referring physicians predominantly care about our assessment and plan and less about the other two sections. And so it's just easier for them when it's in an APSO rather than a SOAP format. So the first thing that I'm going to do is I'm going to click on my I'm going to call it fire off a macro. So I would come in here. We've decided this is going to be L spine stands for lumbar spine. LDH stands for lumbar disc herniation, which was the example that we're working off of. So I'm going to click on that. And that's going to populate all the impairments, all the assessment details, which is where you would write your formalized assessment. And then you would have both their prognosis, barriers to rehab, so on and so forth. Feel free to manipulate these as you so choose. It may be good practice if you so choose to go through this, each one of these tabs if you want to become more proficient at your documentation and actually practicing writing assessments to write it out. That's all fine and good. I would also encourage us to consider where we want to spend the majority of our time and what we want to get out of this experience that is within this rotation in this internship. And so sometimes people would like that practice, but at other times they want to put the documentation as a necessary means, but not their primary focus. And thus I encourage people to consider students and interns to consider utilization of the macros. For clarity on my assessment, so if I hit F3, this expands this small text box. I have a pretty strategic format in which I lay out all of my assessments. So this is standard verbiage that I use. I had the pleasure of seeing test patient, 44-year-old female, so on and so forth. With a pathoanatomical diagnosis, that is their medical diagnosis of discogenic low back pain with or without history of. So the three asterisks within within the Epic workspace are essentially free text fields, and I can hit F2 and I can toggle between those. So I could say without, for instance, lower extremity radiating symptoms. My physical therapy diagnosis, this is probably something that you've talked about at length within your PT curriculum, is going to be the tissue source, tissue stress, movement fault, and the ICF classification. I know that there has been extensive discussions as to what makes up a PT diagnosis. I think that these four elements are the most robust physical therapy diagnosis definition that I have come across. It incorporates both the communication to other healthcare providers that aren't familiar with the movement system diagnosis, that is the tissue source, and the tissue stress also takes into account for the physical stress theory that was established in 2021 with a seminal paper in PTJ. Movement fault is looking more at your movement diagnosis, consistent with what Shirley Sarman and Washington University has established, and that the APTA has adopted as their kind of go-to forms of diagnosis. And then the ICF classification is consistent with our clinical practice guidelines. And so those four components of the PT diagnosis is what makes up my physical therapy diagnosis with each of the patients that I see. And so I'm going to hit accept, and that takes us through the assessment tab. And so this ends video number 1 of our evaluation note.